the restrictions that we put in place last year, we will be rolling over for another month. This is a cautious approach, a safe and measured approach as we move through this next phase, and also ensures that we continue to instil confidence, particularly in our parents, and sending kids back to school. And as mobility increases, as Dr. Chant has said, we will expect cases to rise. So this is a measured approach, a proportionate approach to the situation that we are in here in New South Wales. So as you'd be aware, those those restrictions that will be rolling over for this period include density limits of 2 square metres, wearing face masks indoors, no singing and dancing in hospitality venues. These measures are proportionate, but particularly, taking a cautious approach as we move through and really focus on getting kids back in the classroom on the first day of school this year in a safe way, and as well making sure that we get that non-urgent elective surgery back. The other recommendations we continue to make, and I want to thank people right across New South Wales for the efforts they're doing. If you can gather outdoors, please do so. The social distancing, which we've been promoting, everyone is making an enormous effort, and that is very clear based on where we sit today and the results that we're seeing right across the state. There is a lot of evidence that shows that we should all be reassured across our state and across the country about where we sit, and it's very pleasing, that position. But the one thing I'd continue to ask today is we continue to focus on boosters. Booster shots are key. We've had about 40% of people across New South Wales who are eligible for that third dose booster shot have gone out and received it, but we need to continue that effort as we move through this next phase. Obviously, as you know, those booster shots are available in our 40 hubs across the state, supporting the GP and pharmacies, but we really need to get that booster shot rate higher. We've seen the efforts that people have made. As the Health Minister says, when we're in those meetings many months ago, we never believed in this state that we would get to a position where we'd have a 95% vaccination rate, but boosters are still key. Now, we know that obviously when there's concern and questions being asked, and Dr. Chant will speak to this, in relation to those people who have had COVID, when they're eligible and when they can go out and get that next booster shot. Today we'll be saying it's very clear that that date is 4 to 6 weeks. So within 4 to 6 weeks of you recovering from COVID, you can go out and get that booster shot. We have capacity in our hubs, our 40 hubs, to be doing 250,000 booster shots per week. We still have capacity in that system. We're having many GPs now having extra capacity as well, and obviously pharmacists. So I know many people have been on their summer break, but if you can come back, start the year well, please make that booking. There's plenty of bookings available across our state, in our hubs, through our GP network and pharmacists. If we can do that, that's the best thing that our state, our people can do, as we have done in the past. And that's why when you look at all the evidence, when you look at figures where Australia sits compared to the rest of the world in terms of hospitalisation, ICU and death rates, we've been incredibly successful here in our state because of the efforts and sacrifices that people have made day in, day out. But vaccination has been key in putting downward pressure on the hospital system and putting downward pressure on ICU admissions. So key message today is if we can continue to make that effort, it will ensure that we maintain the success that we've had over the last 2 years. I want to thank everybody for the efforts and sacrifices they have made during this period of time. It ensures that New South Wales continues to stand strong. It ensures that we can get back to normality as quickly as possible, that we can get kids back in the classroom on day one, that we can bring back that non-urgent elective surgery. And can I thank everybody as well for the unity they're showing right across our state, continuing to treat people with kindness and respect. These are enduring values, particularly as we come into Australia Day tomorrow and celebrate everything that makes our country great. I think in what's been a very challenging 2 years, tomorrow is an important day to celebrate those values that we've seen our people display over the last 2 years, and particularly during this period of time.